26th coronavirus update. Today you will hear presentations from County Health Administrator Miranda Hawker and County Administrator Jason Brown. After Mr. Brown and Ms. Hawker give their presentations, there will be time for questions, and also the hard copies of Mr. Brown's presentation will be available on this podium here to the left. So now, Miranda.
Thank you so much. And I'd first like to say our case count is at 541 for our county. That was provisional data this morning, and that has now been finalized. So what I'd like to go over is some statistics of where we're currently at. On May 29th, our county had 122 cases. We had our highest case count ever yesterday, and that number provisionally was 64, and now it's 62 yesterday. More than 66% of our cases occurred in the last 2 weeks. On 5/29, we had 122 cases, 29 hospitalizations, 20 cases in long-term care facilities and residents, and 9 deaths. Today, on 6/26, we are at 541, 51 hospitalizations, 66 cases in long-term care facility and residents, staff, and 16 deaths. 8 of those deaths have occurred in long-term care facilities. Since May 29th, our case total has increased by over 4 times. Our median age is now 40. And if we're looking at the outbreak, on June 7th, Indian River County had 190 cases. On June 21st, we had 405 cases. And just looking at last week to this week, the city of Vero Beach had 205 cases last week. This week, they are at 326, which is a 59% increase. Last week, the city of Sebastian was at 23 cases. This week, they are at 33 cases, which is a 43% increase. Last week, the city of Fellsmere was at 56 cases. This week, they are at 139 cases, 148% increase. So the CDC advises everyone to stay at least 6 feet from other people, to wear a face mask if they are able, because there are some individuals that cannot wear a face mask. And the point is, if all of us wear a face mask, we provide a cocoon of safety around those individuals who cannot. Those people who are under 2 or people who have trouble breathing may not be able to wear a face mask, but if the rest of us can, that protects them. Face masks are in combination with social distancing and frequent hand hygiene can slow the spread of COVID-19. The Institute of Health Metrics and Evaluation from the University of Washington has indicated that up to 50% of transmission of COVID-19 can be reduced by wearing a face mask. I'm very concerned about the number of increases that we've been seeing in cases. The State Surgeon General this week for Florida has issued an advisory regarding wearing face masks in public and social distancing. So when you look at this, these are our PCR tests by residents tested, and this is by residents, not by tests. And this is for year-to-date, week 26, dated yesterday, June 25th, and our week is not done yet. And you can see on that black line that's up there, that's our case positivity rate, and that is now at 8%. And you can see also those red arrows indicated the stay-at-home orders on the 1st of April and then on the 4th of May. But you can see since then really the tremendous increase we've been seeing in our cases. And we're not done with this week yet. So this is what we look at in terms of an epi curve when we're looking at the behavior of an outbreak. And you can see again those red arrows indicating the stay-at-home order and when that was lifted. And you can see our tremendous increase in cases, with yesterday at 62 was our highest case increase yet. So this is by age group in terms of our percentages by those that are 75 and over. That's at 14% of our cases. 55 to 74 is at 18% of our cases. 35 to 54 is at 35 to 54 is at 28% of our cases. 20 to 34 is at 28% of our cases. And then ages 5 to 19 is at 11% of our cases. 0 to 4 is at 1% of our cases. Our deaths, and this is the same as I had presented at the Board of County Commissioners meeting on Tuesday, is at 16%, or 16 deaths. We have had one additional death this week in a 42-year-old male. And really, the CDC has updated its list for people at risk of severe illness. They removed the specific age threshold from the older adult classification. CDC now warns that among adults, risk increases steadily as you age, and it's not only those over the age of 65 who are at increased risk for severe illness. There was an MMWR, Morbidity and Mortality Weekly Report, that was released last week that showed that older people are the higher their risk. The older that people are, the higher their risk of severe illness from COVID-19. So they also looked at the underlying medical conditions that put people at higher risk, and they updated that. For those with chronic kidney disease, those with chronic obstructive pulmonary disease, obesity with a BMI of 30 or higher, and people with an immunocompromised state from solid organ transplant, serious heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, sickle cell disease, and type 2 diabetes. It's vitally important that all of us work together to protect our community, to protect each other. I did also want to touch on the death rates and risk of severe illness that was published by CDC. 8 out of 10 deaths in the United States have been in those adults 60 and older. Among adults 80 years and older with confirmed COVID-19 reported in the United States, an estimated 32.5% required hospitalization, 3.6% required admission to an intensive care unit, and an estimated 28.7% died. Among adults 60 to 79 years with confirmed COVID-19 reported in the U.S., 26.5% required hospitalization, and that's in terms of a percent. 4.7% required admission to an intensive care unit, and an estimated 10.4% died. I really can't underscore enough that we need everyone to do everything they can to help us slow the spread of COVID-19 in our community. I did want to touch on that we have additional COVID-19 testing in Indian River County. Treasure Coast Community Health has expanded their testing that they're doing, and I did want to go over that. They are at Gifford Health Center in terms of a drive-through, and that address is 4675 28th Court on Tuesdays and Saturday mornings from 8:30 a.m. to 10:30 a.m. In Fellsmere at Treasure Coast Community Health, and that's on 512 at 12196 County Road 512 on Tuesdays and Friday afternoons from 2:30 to 4:30 p.m. And at the IG Center, and that's going to be a drive-through at 1599th Street Southwest, Oslo Road, Wednesdays and Fridays from 8:30 a.m. to 10:30 a.m. Limited tests are available, no appointments needed, and that's first come, first serve. Please bring your driver's license, and you'll be notified of those results in approximately a week. We are still doing testing at our health department. Cleveland Clinic is still doing testing at their site. And in terms of hospitalizations, current hospitalizations at Cleveland Clinic and Indian River Hospital, there are 5 hospitalizations with 2 people on event. That's all the information I'd like to go over. I hope that all of you are paying attention to the rapid increase that we've had in our community. And I am asking all of you for your help in trying to mitigate and slow the spread of COVID-19.
Thank you, Miranda. And now you will hear from County Administrator Jason Brown. Jason?
All right, thank you, Brian. Thanks, Miranda. Thank you, everyone, for being here today. Just want to go over a little update. I'm going to recycle Miranda's epi curve there, and I'll tell you, some takeaways I have from that. So if you look at that arrow on the left-hand side back there in April that Scott is highlighting, that's when the Safer at Home order went into place. That was when we were at our previous peak, back at a time when we thought 8 cases a day was a really high number. I'll say that peak, it looks more like a foothill now compared to what we're seeing today. Then you can see the second arrow is when we entered phase 1, and we have seen for a while there things were going along okay, but we've seen a significant increase. So my question that I think of is, how are we going to change that trend? Our absolute numbers aren't too high yet, 500 and change, although one case and one bad outcome is too many. But the trend is very troubling. So how do we stop this trend? How do we change this and stop these numbers from going up? Those are the things that I'm looking at. This just is the weekly positivity, which is just another way of talking about that positivity rate. This is a weekly amount that's tracked. If you look about a month ago, 5-6 weeks ago, we were at less than 1% positive, and now the last complete week was 7.43%, and Miranda's saying now 8%. So just to speak, we've heard a lot of, is this just due to more testing? Well, we are testing more than we were at the beginning of this. However, the number of tests that are coming back positive, the percentage is higher. And to put that in perspective, and a simple way for me to understand is, a month ago we were averaging 1 or 2 new cases. Yesterday we had 62. We're not testing 62 times as many people as we were a month ago. So clearly it speaks to an increase in infections out there. All right, so this is a nice little, I'm a visual person, and keep it simple for me. So this is just kind of a simple illustration of that light blue colored person there in the middle represents the person with coronavirus, and then he is infecting people as he goes about his business. Maybe he's asymptomatic, maybe he's pre-symptomatic, maybe he's having some minor symptoms but thinks of it as allergies, and he's going about his business, potentially infecting other people that he interacts with. So now he can infect nobody, 1, 2, 3, who knows how many people. But our goal is to reduce that number of people that he's infecting. So we need to find a way to reduce the number of people that person is infecting. And I'm just a simple county administrator, a lay person, jack of all trades and a master at none, perhaps. So I have to listen to the experts. And what the experts say is that masks and social distancing are the best tool that we have in the toolbox. So we need to use that tool, these tools, to the best of our ability to reduce this spread. I'll just read a little something from the Florida Medical Association president put out that says, the FMA, the state's largest physician organization, encourages local officials to adopt regulations requiring individuals to wear face coverings in public places. So that is yet another expert from the Florida Medical Association doing that. The other thing I'd like to illustrate is, a month ago we were having 1 or 2 of these folks show up positive out there maybe infecting 1, 2, 3 other people. Yesterday we had 62 new ones, and so before they received their test and knew they had COVID, they may have spread that to other people. And so rather than worrying about 1 or 2 or 3 people a day, along with the people that are asymptomatic that may never know they had COVID from going out there about their business and infecting folks, we have 62 new ones yesterday. All right, next, and I'll tip my hat to Larry here a little bit with his article, thinking of along the same vein. Here's Rosie the Riveter, a mascot from World War II, where when America was faced with significant challenge and fighting World War II. And at that time, Rosie the Riveter, most of you know, but if you don't, she was the mascot for women to really, for the first time in mass, join the workforce. Because why did they need that? Because most of their husbands had been drafted or volunteered to go off to fight war. But what the home front needed to do was manufacture tanks and airplanes and weapons so we could aid in the war effort. And the men that were doing that in car factories that were converted to tank factories were not available to do that, so women joined the workforce. And today that's something that doesn't seem unusual, but that was a major change in that time. They also had food rations where you could only get so much meat a week and so much of certain types of food, so they could send the food over to the soldiers. So I say all this not to equate what we're going through with World War II. That's clearly not my intent, but it is an example of a time that this nation faced a great challenge. We rose to that challenge. Government asked us to make sacrifices much greater than we're being asked to make today, although our sacrifices are significant. So my story here is that we've done this before in this great nation. We rose to the occasion, defeated Nazis, defeated Communist Soviet Union, defeated 9/11 terrorists, and we do this over and over and over again. And again, not to equate this or compare this to those challenges, but I believe that America, and particularly Indian River County residents, are up to the challenge. We can all work together to defeat this smaller and invisible enemy. So, as I talked about on Tuesday at the County Commission meeting, we've got the sledgehammer and the scalpel. I talked about the lockdowns. Obviously, I don't think that's the tool we want to pull out again. I think masks and social distancing and hand washing and not touching your face are the new tools that we need to use. Those, again, are a much smaller sacrifice than requiring people to close down businesses and lose jobs and maybe lose businesses. So we are in the position where we can open businesses, but in order to do that safely and not have an increase, we believe additional masks and social distancing needs to be followed. I also want to point out that if we don't wrangle this thing back under control, that lockdown that we had all across this nation will have been for nothing. We will have gone through significant economic and financial damage and job losses and bankruptcies. And if we let all that good work, hard work, go to waste, which bought us time to be able to respond to this better, I'm afraid all of those sacrifices will be for naught. So, a lot of people have concerns about government requiring masks and that being an infringement upon people's rights. I want to let you know here at Indian River County, we believe in limited government. We believe in not having government overreach. However, at times, there is a need to require things of our citizens. So we avoid doing these mandates and requirements unless absolutely necessary. And we do not take any of these decisions lightly. Our goal is always to not be an overreaching governmental entity. I think that's evidenced in everything we do at the county. Another thing I want to talk about is our elderly and vulnerable population. Miranda talked about those 65 and older. There was an order from the state surgeon general recommending those folks stay home as much as possible, and I agree that's good. But I think we need to think about those folks as well. If we don't do something to limit this spread, and if we don't wear masks, because my mask protects you, your mask protects me, are we relegating those folks that are 65 and older or have underlying health conditions to stay in their home and not be able to go to the grocery store or risk infection by doing so? I think we owe it to our elderly and our vulnerable population to do what we can as citizens and neighbors and good human beings to do what we can to reduce the chance of infecting our most vulnerable. So, with that, this morning, I signed Emergency Order 2020-15, and that is based on the conditions that I have continued to see in this community, based on the discussion and general direction received from the Board of County Commissioners at a regular meeting on Tuesday. What does this order do? So, this order requires masks only for employees of businesses that serve the public. For instance, restaurants, retail operations. There is not a mandate requiring the customers or the general public to wear masks. However, we do strongly encourage everyone in the county to wear masks when out in public, particularly if you're indoors and particularly if you are unable to socially distance. I do want to point out that the order provides exemptions to the mask requirements for those with underlying medical conditions that would prevent them from being able to wear a mask, as well as others that you can see in the order, which we will provide a copy to you shortly. One instance is children 2 or younger are not required to wear masks. I will also mention that this mandate on the employees only applies to the unincorporated areas of the county. Our municipalities will be able to make their own decisions on this. This is a very challenging issue. I would encourage them to do the same, and they are going through that decision-making process to determine whether or not they will follow the county's order on this. Again, everyone throughout the county is encouraged strongly to wear those masks. And again, our focus in this order is on voluntary compliance through education and encouragement, and we view enforcement as a last resort. We are also requiring everyone, all visitors to indoor county facilities such as county administration building, libraries, fire stations, IG center, what have you, to wear masks. Additionally, riders of the GO line, our public transit system, will be required to wear masks. Again, the same exemptions apply there for those with underlying medical conditions. And if you do not have a mask when you arrive at one of these facilities, one will be provided for you. The order does become effective Monday morning at 8 a.m. So, our Rosie the Riveter for 2020 with her mask on. I believe that we can all unite together to defeat this invisible enemy. Rather than us being divided against each other, I believe we need to be united with each other against this common enemy. Together, Americans can defeat any enemy, no matter how large or small. I know Indian River County residents in particular are up to the task. Thank you, and I will turn it back over to Brian for questions.
Thank you, Jason. If you have any questions, you can step up to this podium here and speak into the microphone so those that are viewing either on Indian River County Government Channel 27 or online can hear you.
My name's Ed Kowaleski, and I'm 82 years old, and my mind doesn't absorb a lot of facts and figures and PowerPoints and so forth so well anymore. I've found out that my mind will only absorb what my butt will endure. But when I get on anti-social media, I hear all kinds of different descriptions of what these tests provide, and I have a question to you folks now. Of all these 543 new cases, the 60, whatever it was, 62 yesterday, are they all contagious? Are they all ill? Are they able to spread the disease? And how reliable are the tests? Is it 100% successful, 50% successful? I remember the older days, back when a little bit ago, we couldn't really rely on a test at all. And if I would get tested for the virus right now, which I haven't done, because I don't want to be tracked, I don't know what you're going to do with that information. And also, my daughter had the virus for sure. There's no doubt about it. Her symptoms were so severe and so long, and she couldn't get to the hospital. She couldn't be tested when she had it. They told her to stay home and tough it out. And she never did get tested. She got over it. This happened a few months ago. And now they want to test her. She's not going to go because she's a fear. She doesn't want to be tracked. I went to the drugstore to get a prescription that's pretty commonly used now for people to get a little bit high on. And as soon as I got back home, I got a call from a lady from who knows where. I wanted to know how I'm feeling, what I'm doing, so forth. So I guess my question, I have two questions. I don't understand the test at all. And my second question is, once I'm tested, what are you going to do with it, that information? I certainly do not want to be tracked. Thank you.
Okay, so I can explain the testing. So the testing the department is using is validated and it's reliable to use. What I can tell you, there's a lot in your comments. And what I can go through is when someone tests positive for COVID within our county, those lab results come electronically to the Department of Health. And so what we then do is contact the individual. First of all, we see how they're doing. We are telling them that they need to stay home and self-isolate for a period of 14 days. And specifically, if they're not being there, in general, it's 14 days. And it needs to be a minimum of 10 days. And that would have to be 3 days from resolution of a fever and 10 days minimum. But in general, we're telling people 14 days. So what we're doing with that information when we call you, we're asking you about your close contacts. We are asking you about those people that you've spent really over 15 minutes.
I would appreciate if you just answered the questions that I brought up. I don't.
So, sir, you brought up multiple points, and so I'm explaining what we do when we contact you, what we're finding out, because those people you've been in close contact with could then develop disease.
Let me ask you again.
Part
I don't keep interrupting you, but if I'm tested positive for it, am I contagious? Number one, what are you testing for? Whether I ever had it or if I have it actively, am I going to be ill when you test me? And am I going to be contagious? That's what I want to know.
So when we
What kind of a
test
test does it look
people
for?
with a PCR test, that is showing whether you are actively infected. If a person is actively infected, they are told to stay at home for a period of 14 days.
It would be contagious.
Yes, you would be contagious. People can be contagious even if they're asymptomatic.
Right.
And that is another proportion of the public which we may or may not know about, depending on if they've been tested.
So when we're asymptomatic, we don't know how long we would be contagious? Or would we ever be not contagious?
When you're asymptomatic, you're also contagious for roughly the same period of time that you would be if you had symptoms.
Okay.
And so, for instance, for your daughter, I believe you said, who strongly thinks she may have had COVID,
Mm-hmm.
Those tests that you would use for that type of individual is something called an antibody test. So we're looking of past evidence of infection. Now those tests, the CDC is only recommending the use of those tests to really check the level of infection in a population, or for people who have been infected but are outside of the period of time we would pick that active infection up by PCR. And so then the CDC is recommending those tests.
So the 543 cases are all contagious people.
So the 500, and I had said that 543 was provisional and was just updated before we came here today. It's 541. And so that is our people who have ever been infected with COVID, which 66% of those cases of that 541 have occurred within the last 2 weeks. So it's likely those cases in the last 2 weeks are contagious. And so that is why in public health, we work to make sure those cases are self-isolating at home and they're not going out. So they can't make other people in the public ill. So people who are not wearing a face mask, people who can't wear a face mask, that they are better protected because those individuals who are contagious are self-isolating at home. Did I answer all of your questions, sir?
All but one.
Okay.
If you get tested for this disease, are
Mm-hmm.
you going to be tracked and put in a category where they're going to be looking for, what's the word I want, Ruth? When they keep track of you.
Track you.
Okay, whatever it's called. They hire, again, I'm on anti-social media, but I read where they're hiring people to just specifically track us down and call us and see how we're doing and start a file on you.
So
Is that going to happen if I got tested? I'd like to get tested, but I haven't done it.
Well, so when we're doing contact tracing, sir, we're doing that on people who are positive,
Yeah,
that we're looking for those contacts.
so if I got tested.
Until you if you're tested, you're waiting for your results to see if you test positive. Now, if you're with symptoms, we're recommending that you stay home, limit your interactions with others, and we're recommending that.
Well, my concern
and
is
to
how
wear
would
a
you
face
put in the
mask.
data bank then with when I would be tracked. Mhm.
So what I can tell you is if you're testing positive,
Yeah.
then yes, we are tracking those individuals. We're recommending that we are telling them to stay home.
Understand.
And we're also contacting their close contacts that they've identified in an effort to keep more people in our community healthy and limit the spread of disease.
I understand. Thank you.
Yep.
How's it going? I had 2 questions for Jason Brown, if that's okay. So the first question, I wanted to know how this mandate will be enforced.
So again, our focus is on education and encouragement. The order requiring the masks of certain employees of businesses that serve the public applies to the unincorporated area. We have discussed the enforcement with the sheriff's office. But again, our goal isn't to throw people in jail over not wearing a mask. Our goal is to educate folks and encourage them to do so. And as it states in the order, enforcement is a decided last resort.
Okay. Do you think that there could be fines or anything like that if employees fail to?
Under the penalties are as prescribed under Florida Statute 252, which there's more specific info in the order, and we will provide a copy of the order following the conference.
Okay, thank you. And that said, one more question. And so for the general public, masks, they aren't required unless people go into indoor county facilities or unless they were at the goal line. But
Correct. We will be requiring masks for everyone who comes to a county facility that's indoors, like the building that we're standing in, libraries, things like that, and for riders of the Go Line bus will be required to wear masks with those same exemptions for folks who have underlying medical conditions And if you don't have a mask will be provided for you.
Okay, thank you. And I have 2 questions for Miranda. For the 8% positivity rate, was that daily or was that weekly? Just wanted to.
That's based on our last week to date, week 26,
Okay.
based on our data.
Okay. And for the hospitalizations, you said 5 people are currently in the hospital with 2 people on a ventilator?
Yes, that's correct.
Okay, gotcha. Okay, thanks.
Yep.
Mentioned that this only involves unincorporated county. Have you been working with the cities to see if they were going to also adopt this?
Yes, Colleen, we have been in discussion with the municipalities. I can tell you that the city of Fellsmere has told us that they will be implementing this requirement as well. The other municipalities have not made a final determination. I would encourage you to contact them if you have more questions about their plans. I think they may be making a decision on this still.
Okay, so do you think that there'll be confusion if a business is, for a business to determine whether they're in the municipality or if they're in the unincorporated area?
Well, we've got maps that are available online. You can see if on the county website, on our GIS maps, you can see if you're within a municipality or not. I would hope that our municipalities would issue a similar order, but again, respecting their local decision-making process, we are not attempting to impose this on the municipalities at this time and letting them make their own decision on this.
Okay, and one final question. Do you think that there'll be a point where you will change the voluntary mask wearing to mandatory for the public?
So we're putting this order in place right now. We're going to continue monitoring our current conditions, and as those change, we will make adjustments as necessary, and I would not rule out further action.
Thank you.
Hello, I'm Ruth Kovleski. I had a couple questions and comments. First, I'm a little confused by your numbers, and I think that's what was being asked earlier. If we have like 167,000 people in our county, and you're saying this 536 number, only 60% of those might be positive and possibly infected right now, then I'm looking at a 0.0019 infection rate, not this 7% that I keep hearing said. Another thing that I'm concerned about is the COVID deaths, as you can see here. With 16 in 2020, we had 29 flu deaths in 2017. So we didn't wear masks or shut down, and somehow we got through that with much less economic damage, as well as a lot of people who feel that they are harmed by masks. So when I'm looking at those numbers, they don't support this loss of our Second Amendment rights, I feel. We don't have any medical evidence. We have a 0.0009 death rate overall in the country. Disabled people who can't wear a mask are now going to be excluded from all of our county buildings, et cetera. That's a big concern of mine. And the Indian River County has a 2%, even overall, 0.02% positive COVID rate, which means we do not have, 98% of people are not even going to have a problem, and that's been from the very beginning to now. We talk about our body, our choice. That works, that we can kill a baby inside of us, and a human being, but that doesn't work for us to keep our bodies healthy. Masks are unconstitutional. They harm our bodies. There is science on that, OSHA and our other scientific studies show that many people will be sicker and cause more virus to be spread by wearing a mask with these underlying issues. And now, unfortunately, it feels like we're going to do face masks now, And you have said, and I've just read in your material, that that's because there's no vaccine available. Is your intention, or do you believe, as most people think, that vaccines will be mandated once you do receive a vaccine, or pushed to this degree on people who cannot or will not take a vaccine that alters their DNA? I also am concerned that executive orders, I don't know where your camera is, there it is. Executive orders don't trump the Constitution and our Second Amendment. And I'm hearing from you, and correct me if I'm wrong, you just told this other gentleman that cases don't mean they're sick. Cases mean our daughter did have a test after all that, and she was negative after clearly having had, but it was at a point in another state where she could not get tested. Clearly had all the symptoms of the virus, was ill, like we get with a very, very bad flu, and there weren't testing available, but now it is a negative test, even after all of that. So we just heard that our Congressman, Posey, from your own commissioner here the other day, and he put it on his website, that he tested negative one night and positive the next day. That's our Congressman putting that on his website. So the test reliability, the numbers you even have here of maybe 300 people possibly being sick or ill or a spreader, does not support what we're doing here for a loss of rights. On top of that, my concern is that you have people losing rights in order to make everyone else feel better. There are these plastic shields that I've talked to you all about that they could wear to protect their eyes. Jason could have one on right now. It would protect his eyes. You wouldn't force what you'd like to do, which I'm happy with you wearing a mask if you like to, but it wouldn't force that on all the other constituents here, people in the county who do not want to wear a mask or cannot. And lastly, I've asked, and it was asked by one of your commissioners the other day, and there was no answer. You're doing a lot to pump up this mask mandate by you, basically, and will be instituted now by law, I'm assuming, by law enforcement officers. What have you all done, or what are you doing to stop the shaming of people who can't wear a mask? You said that there are people, you've put in an exemption, which I do very much appreciate, at least that you've done that, but what are you doing to educate people that they shouldn't be shaming? There's nothing in the order that says no one should be shaming or attacking, or in your Rosie the Riveter kind of things. Could you not put something for the public out there to say, don't attack people that don't have a mask on because they have a medical exemption? Because everything else you say really says those people don't care about the rest of our county. Because we don't see them with a mask, people are shaming them because they're not aware that there should be some allowance for those folks. That's a big concern because it causes a lot of fights and upheaval out there. That's my question.
So you had quite a few points in there, and I want to clarify those that were in terms of relation to public health. So when we look at masks, it's much in the same way that we look at vaccine. And so when we have people that can't be vaccinated, and we have people that can't wear a mask, and certainly we discuss that each time we're talking about masks, people who have trouble breathing with a mask on, or those kids under 2, that we're providing really a cocoon of safety around them by getting the rest of the public to wear a mask to be able to protect them. Because certainly when we look at those deaths that you reported from flu, which I haven't looked at that recently, so I can't confirm that 29 number, but those 16 deaths we've had with COVID-19 have been in the last 3 months. The other data that when you hear about flu deaths, that's an annual statistic. And so these last 2 weeks, we've had 355 cases. And that's an awful lot of
Haven't we
cases.
been doing this since March, not April? You said 3 months?
We've been doing this in terms of our first case date. So yes, we have been doing it through March, but Indian River didn't get its first case until April, as I recall.
Right,
But what I can say, ma'am, if you would let me
encompass
speak,
that time, correct?
please.
Even though we didn't have a case, that would encompass those times without.
My concern is to educate the public on our mask recommendations. My concern is to educate the public in terms of numbers we've seen and our positivity rates that we've calculated from the Department of Health. And what I can tell you, my concern is the public health. My concern is to protect all of our residents, including those who cannot wear a mask. The Department of Health has not ever victim shamed, as you've put it, as I recall. The Department of Health is concerned about all of our residents and the public's health, and that includes your health. So when we have mask recommendations, and that is certainly a recommendation from the Florida Department of Health, from the CDC, from the World Health Organization, with the goal of minimizing the spread of disease within our community, keeping more people healthy, keeping more people alive from those people who are most at risk of serious illness and death.
And I don't think you answered the question about the plastic mask, and I've asked that in the commission meeting the other day, truly. What is it that another person like me, wearing a mask right now for you, if I could, what would it be that does something for you? Why is your mask not sufficient, especially if you covered your eyes with the clear masks that come down the shield? Wouldn't that be just as healthy for you? And then you'd be taking personal responsibility for your body and keeping yourself safe, and you wouldn't have to be forcing that on other people, kind of like, I'm not a victim, I can be powerful and take care of myself. What is it that will do for someone else that they can't do for themselves in some way?
So if everybody wears a mask, my mask protects you, your mask protects me. Since you can't wear a mask, I'm doing the best I can to protect you. But when we're talking about a disease that has 35% of people that are asymptomatic, anybody could be infected. So that's why the mask recommendations are what they are. That's why Mr. Brown has taken the action that he's taken, recognizing that we have 4 times the amount of cases that we've had since the end of May.
Right, but you didn't answer my question. If your mask is protecting everyone else, like me, why isn't it protecting you too? That someone else needs to do that for you. That's like saying I have a hazmat suit on and I'm only doing it to protect you, and it's not really protecting me too. There doesn't seem to be any logic to that.
Because we all have to do our part.
But if you're protected, then I can't harm you.
From your breath. Your breath isn't.
She has a mask on, sir, and I'm not talking.
I understand that, but
Does anybody have any other questions related to the requirements laid out?
Yeah, I've got a couple questions for Miranda. One would be, you talked about all these cases coming up. Do you have the manpower to track each one of those down in terms of contact tracing? And
So what I can tell you is that certainly we've had a large number of cases in these last few weeks. And what we've done is requested additional assistance through the ESF8 desk at the state EOC. And we've had additional resources come into our county to help us with contact tracing.
okay,
But certainly the number of cases we have, we are prioritizing our case investigation, certainly by those at most risk. But we are working our way through the list of cases.
okay. And the second question would be, there seems to be an uptick in the Fellsmere and everywhere. So the question is, are you finding, certain things, certain places where the disease is spreading? Is it, I'm gonna let you answer the question. I don't want to lead the question, but are there certain places, types of businesses, households, residential issues, where these things are spreading?
So I can tell you as you can see, our median age has really dropped. It's at 40. And so we're seeing a lot more young people infected. And so we also are concerned about the amount of large gatherings that we've seen. We're concerned about people congregating in public. without a mask, and that's why you see that recommendation come out, because with those masks, we help to slow the spread. But I am concerned about the congregating of people in large groups. I'm concerned about people congregating in public, really, because we see that throughout our county. I see a large amount of people without a mask. I see a large amount of people in close proximity. So in particular, we've seen some cases and connections with large gatherings, and that's also something that we track. We've also seen additional cases in long-term care facilities. And the growth in those cases from 20 on 5/29 to 66 as of today is significant.
What about places like, you talked about these large gatherings, are we talking about weddings, parties, are we talking about bars, are we talking about, what exactly are we talking about in terms of the large gathering?
So I can't go in more detail than that, Larry, but what I can say is that's something that we are tracking.
I think that would help if you could release that information. That would help people understand to take certain actions, you know, and to amend their actions if that's necessary.
So what I'd like people to do is make sure to comply with the direction that the governor set out through his executive order, to comply with what's recommended by the CDC in terms of staying home as much as you can, going out for essential trips, minimizing your contact with other people, and maintaining your social distancing. I mean, those are the key messages, rather than, certainly large groups are part of those recommendations, but if people can focus on those basic things to slow the spread, wearing a face covering, maintaining that 6-foot distance, frequently cleaning their hands, if they could focus on that base message, that's what's going to help us slow the spread.
Thanks.
First of all, just want to say I think the Palm Beach video, I don't know if you saw it this week, has a contender, so, for viral videos, if you get that. So I just got a question for Jason. How much easier, first of all, I applaud you for doing this. Wish we would have done it sooner. But how much easier would it be if President Trump wore a mask at all times to implement this?
I don't want to address that. I just want to say, we're just hoping to encourage as many people as possible to wear a mask.
Would it be easier if he did, though?
What we are doing is what we can in Indian River County to send the message. There's a lot of different thought on masks, and we are trying to encourage everyone to wear the mask, because my mask protects you, your mask protects me. So to be considerate of others that you might infect, we just encourage everyone to wear a mask.
Okay.
I'm just going to be real quick. The testing seems real confusing. Do you still have a hotline that people can call?
Yes, certainly, and I'm sorry that that was confusing. I apologize.
Well, it's different days, different times. Nobody's going to remember it. How can they find out?
So sure. So what I cited, because I'm sorry, because I was excited that they're doing the amount of testing they are, is Treasure Coast Community Health has increased the testing that they're doing. That is available on their website for those specific dates and times. Cleveland Clinic and Indian River Hospital is still doing testing Monday through Friday from 8 to 5. We are doing testing at the health department, and you can call the 794-7411 number, and we can make an appointment to get you tested.
And would that be an information hotline that people can call?
That's our general line that we've established in terms of our call center.
Okay, so
for
the hotline
COVID.
doesn't exist anymore?
The hotline for the state is still in operation.
A second quick question is, we haven't heard from the sheriff in quite a while. Is there any concern with the jail population specifically?
What I can tell you is we currently do not have any cases in our jail population. We have one correctional case, but that's an employee that's employed in another county in corrections.
Thank you very much.
Thank you, everyone, for attending our press conference. As always, you can contact the county administration, or you can put in a request to speak during a Board of County Commission meeting. For all other information related to Indian River County's local response to COVID-19, please visit our website at ircgov.com. Have a great weekend.